Good day, my name is Logrolling a first-year nursing student at Central Mindanao University. So in this video, I will be demonstrating the procedures on Logrolling a Client. So prior to performing the procedure, we have to introduce ourselves and verify the client's identity. So good morning, ma'am. My name is Logrolling I will be your nurse for today. Kasi ang pangalan, ma'am?
Ako si Abigail na
Kasi ang birthday, ma'am?
March 1, 2007.
Okay, thank you, ma'am. So we already identified the correct patient. So we have to do that in order to make sure that we will be giving the intervention to the correct patient. So the next step that we have to do is we also have to explain to the client what we are going to do, why is it necessary, and how this client can participate. So for the patient to know you and also to ensure that the right patient will receive the intervention, we have to do the first step that we did. And discussion will give a reassurance to reduce the anxiety, fear, and confusion of the patient before and during the intervention. So let's proceed to the next step. So the next step is we have to perform hand hygiene and observe other appropriate infection prevention procedures. So I will be using this alcohol-based hand rub to prevent the spread of microorganisms. So I'll just rub my hands until it's dry. Okay, now let's proceed. So the third step that we have to do is we have to provide for clients' privacy. So we have to close the curtains and also the doors. So since I already did that, so we can skip that part. So to secure the patient and maintain his or her morale, we have to give her her privacy. Now let's proceed to the next step. So we have to position ourselves and the client appropriately before the move. So place the client's arms across the chest. So ma'am, pakikita po butang paan na bilisin mo arms mo. Okay, thank you. So the next step that we have to do is we have to pull the client to the side of the bed. Use a friction-reducing device to facilitate lag rolling. So first stand with the other nurse on the same side of the bed. So, nurse, there is a nurse. So, in the count of 3, I should be the So, wait. So, assume a broad stance with one foot forward and grasp the rolled edge of the friction reducing device. So, and after that, on a signal, pull the client toward both of the nurse. So we will be pulling the client using this friction device to pull the client toward us. So one nurse counts 1, 2, 3, go. Then at the same time, all staff members pull the client to the side of the bed by shifting their weight at the back foot. So moving the client in unison maintains the client's body alignment. So in the count of 3, I wait nurse ang imong isa ka pera Okay, in the count of 3, 1, 2, 3, pull. Okay, good. So the next step that we have to do is one person moves to the other side of the bed and places supportive devices for the client's when turn. So that is done to support the patient completely. So other nurse, dito sa kasa. Okay, there. And then, the next step that we have to do is we have to place a pillow where it will support the client's head after the turn. The pillow prevents lateral flexion and of the neck and ensures alignment of the cervical spine. So I will be putting pillow right here. And then, let's proceed to the next step. So, the next step is to, we have to place 1 or 2 pillows between the client's legs to support the upper leg when the client is turned. So, ma'am, mabutan po o kung ano sabi din sa imong legs, ha, pillow para sa imong pagbuan. So the pillow prevents abduction of the upper leg and keeps the legs parallel and aligned. Now let's proceed to the next step. We have to roll and position the client in proper alignment reaching over the client, grasp the friction reducing device, and roll the client toward me. So this is for efficient moving of the client. So please give me the okay. So the next step that we have to do is we have to reach over the client, grasp the friction reducing device, and roll the client toward me. So the next step is one nurse counts 1, 2, 3, go. Then at the same time, all nurses roll the client to the lateral position. So, balin sa kadiri nurse. So the next step that we have to do is we will be rolling our client using this assistive device in the count of 1, 2, 3. Okay, so balik sa kadiri. Okay, so this is to avoid injury and having a synchronized movement. So the next step that we have to do is we have to support the client's head, back and upper and lower extremities with pillows to avoid any injury. So we will be this right here. So the next step that we have to do is we have to raise the side rails and place the call bell with the client's reach. So we have to do that to prevent the patient from falling. Okay? And now, after we did that procedure, we can now proceed to the last step, which is to document all relevant information. So time and change of position move from and position move to, any signs of pressure areas, use of support devices, ability of client to assist in moving and turning, response of client to moving and turning, example anxiety, discomfort, and dizziness, and to have a record of it that can be used for future intervention. So that's the end of this procedure. Thank you for watching.